So don't forget to follow me on Instagram, High Carb Health. Hit the follow button and click on the green H to see what I get up to. What I eat, what I do, it's all here. You can follow me on what I eat as well. So check it out, guys. Hello everyone, welcome to another video. I'm here with a special guest today. It's Robyn Chuter from Empower Total Health. Robyn is a certified lifestyle medicine practitioner and we're really happy to have you on our channel today. So talking about this long-term damage, what does the science tell us that, what can happen to our bodies if we stay in this meat-heavy, fat-heavy state for a long period of time?
Yeah, well, I think the most interesting research on this relates to the effects of the ketogenic diet on the gut microbiome. And once you understand what a pivotal role the gut microbiome plays in immune function, regulation of inflammation, metabolism, how hormones are dealt with, basically everything to do with being, an operating human, then you see that damage done to the gut microbiome is just so serious and has so many implications. So what do we know about that damage? First up, when you eat a high-fat diet, that increases the amount of bile that your gallbladder releases, okay? So bile production is triggered by the presence of fat in the small intestine. If you have a small amount of fat, small amount of bile. If you have a large wad of fat in the small intestine, there'll be an enormous secretion of bile. Now, bile's job is to emulsify fat, and we need that. Fat's got some valuable stuff. It's got vitamins. It's got fatty acids that we need. So the bile then emulsifies fat, lets us absorb the good stuff. But then that bile travels through the small intestine and into the colon, the large intestine, where it is acted upon. It's actually metabolized by certain species of bacteria. Now, what we see in the large intestine of people who eat a high-fat diet, including a ketogenic diet, is a bloom of bile-eating bacteria. Two main species, they're called Drosophila vibrio and Bilophila wadsworthia. So these characters actually metabolize bile. They produce what are called secondary bile acids, and these damage the bowel wall. So we know that these secondary bile acids are elevated in people with ulcerative colitis, and they're the agents of damage in the colon. In the long term, exposure to these secondary bile acids also increases the risk of colorectal cancer. So that may be like, I have heard from gastroenterologists that they're now seeing colorectal cancer occurring in much younger people than they ever have before. Bowel cancer was always an old person's disease, right? Over 55, up goes your risk. But they're now seeing it in people in their 30s and 40s. So these are the people who jumped on the ketogenic diet bandwagon maybe, 5-10 years ago. And the damage that they're doing to their guts is so intense that they're actually developing cancer at a much earlier, much younger age than we've ever seen it before. So the Drosophila vibrio, so these secondary bile acids produced by bacteria like Drosophila vibrio and Bilophila wadsworthia are really damaging to the bowel wall, as I said. But the other thing that you see is a suppression of bacteria that you would see in abundance in the bowel of a person like you and me who eats a lot of plants and therefore has a huge variety of carbohydrate molecules that are found in plants, or carbohydrate components. So if you eat whole plant foods, then the carbohydrates, there are certain carbohydrates in those that will be digested and absorbed in the upper gut, in the small intestine, like sugars and starches. But then there are a lot of carbohydrates in those plants that we don't digest and absorb because us humans don't have the right enzymes for that. So down they go into the colon, where again, they're acted upon by bacteria. And they produce compounds like butyrate, which is a short-chain fatty acid. So butyrate, number one, if you've got a gut full of these bile-eating bacteria, they actually reduce your populations of butyrate-producing bacteria. But then you're also starving them if you're on a low-carb, high-fat diet, right? Whereas you and I, we have these huge populations of butyrate-producing bacteria. So what does butyrate do? It's an anti-inflammatory, a systemic anti-inflammatory. It provides 70% of the energy needs of the cells that line the colon. So if you deprive those colonocytes, as they're called, of that fuel, they're basically starved. And again, they're more likely to turn cancerous or to become aberrant, like we see with inflammatory bowel disease. So butyrate also is insulin sensitizing. It helps insulin work better. So ultimately then it helps to prevent metabolic syndrome and type 2 diabetes. Butyrate is absorbed through the blood-brain barrier, and it stimulates the growth of new brain cells through causing the release of something called brain-derived neurotrophic factor, BDNF. And BDNF is described by neurologists as miracle growth of brain cells. It causes new ones to grow, and it causes new connections to grow between the existing ones. So, in other words, it's really critical for learning and remembering stuff and not becoming demented as you get older, okay? So butyrate is just amazing stuff, and you just can't have enough of it if you're eating a low-carb diet. A lot of people on the ketogenic diet say, I get plenty of fiber, I eat lots of vegetables. But if you actually look at the fiber content of vegetables, it's not enough. And also the diversity of it is not enough compared to eating a varied whole food plant-based diet to get enough butyrate production, but also to have sufficient just variety, or what we call diversity, in your gut microbiota. Whereas a diet of whole plant foods, as intact as possible, because it's so diverse, it creates a diversity in your gut microbiota. And that's what we know is healthy in the gut microbiome. So that was a long-winded answer to your question. Tell me if I missed any part of it that your listeners want to hear.
No, I think that was fantastic, and I think a lot of people kind of flock to these kind of diets, especially for IBD. We find that a lot of people are getting some short-term relief from these kind of diets, and maybe you can tip into why that might be happening. Because
absolutely, and not just IBD, but a lot of people with IBS are trying these diets or even having these diets recommended, and the mechanism is actually pretty straightforward. So with IBS and also with IBD, although obviously they're very distinct conditions, as you probably know though, IBD and IBS can actually coexist. So a person can have visible damage to their colon, which you can see on a colonoscopy or endoscopy, but they can also have IBS-type symptoms. So once the wall of the gut is irritated, you can develop a condition called visceral hypersensitivity. So viscera means your guts, and hypersensitivity is probably fairly straightforward to understand. So what happens here is that when those bacteria that ferment carbohydrate, when they carry out that fermentation action, the result of that is gas. And those of us who've been on a plant-based diet or switched to one will notice that, we produce gas, which is totally fine, because that gas production has to occur when our bugs are making these awesome short-chain fatty acids like butyrate. But back to the gas. So gas causes some distension, like some stretching of the wall of the bowel, both the small and the large intestine. In a person who's developed visceral hypersensitivity, that distension is experienced as discomfort or pain. And the brain's response to that is the sensation that we call bloating. So bloating is the feeling of overfullness, and abdominal distension is where you look down and there's a food baby, right? So like 2 hours after you ate or something, it's like, oh my goodness, what's that? And people are unbuttoning their trousers and loosening their belts and all the rest of it. But the fact is, the human gut is highly evolved to tolerate large amounts of gas, right? So it's not that gas is a bad thing. It's just that in a person who's become viscerally hypersensitive, the presence of gas makes them feel pretty damn uncomfortable. So if they cut out all those plant foods and get rid of, basically starve out those bacteria that would produce the gas, they now feel pretty comfortable. their pain and discomfort drops down. Oh, and by the way, that pain and discomfort trigger IBS-type symptoms, including diarrhea and cramping. So some people will get relief of their symptoms by doing these diets. The problem is that they're, again, dropping their gut microbiota diversity. They're did I mention, by the way, sorry, I don't think I did, one of the other things that butyrate does is it actually heals up the condition that we call leaky gut in popular terms, or intestinal hyperpermeability if you want the medical parlance for it. Butyrate is necessary for fixing those tight junctions, the little proteins that form like a washer, like a seal between the cells of the small intestine, right? So you get that symptom relief, no doubt, but there's a very steep long-term cost. And you and your listeners are probably aware of the low FODMAP diet that was developed by Monash University to treat IBS. And it's become popular in some circles in the IBD treatment world as well. And I've seen a couple of papers published on it. Now, Monash's own research that they published on their website showed that 2 weeks on a low FODMAP diet significantly decreases gut microbiota diversity. So Monash themselves are saying, don't do this diet long term. You do it for symptom relief. You do it to get your IBS symptoms or your IBS kind of like complications of IBD under control. And then you get yourself back on those plans, back on those symmetrical carbohydrates, because otherwise you are setting yourself up for a world of trouble down the track.
Yeah, for sure. That's fantastic. I think that was really well-rounded. I think it really explains a lot of what's going on in today's community. People are really experiencing the discomfort, as you talk about, in the bowel. When they switch to a plant-based diet, the initial discomfort that comes with that can be hard to deal with. And
absolutely,
we try to explain to a lot of people that we work with and also that follow us is that it sometimes gets a little bit worse before it gets better. And you kind of have to get through that if you want the long-term result. I have a saying that I talk to my clients about. I say, you need to go through a little bit of short-term grief for that long-term relief that you're after. Because if you choose short-term relief, you're going to be in the cycle of long-term grief where you keep on flaring and you keep on getting issues.
I would say, though, there are three things that I recommend to ease that transition phase, especially in a person who has a lot of abdominal discomfort or pain. Because, look, bear in mind that when people have this visceral hypersensitivity, it's very highly associated with anxiety and depression. So for some people, like they can just tough it out and it's not very pleasant. But yes, they get through it, their gut bacteria adapt and they're hunky-dory. But for some people, they really get knocked around physically and psychologically. And so there are a couple of things that we can do to kind of ease that transition. One is to use prebiotics, very slowly fermenting prebiotics. Particularly partially hydrolyzed guar gum, which feed up the butyrate-producing populations of bacteria, but they don't cause a lot of bloating. I'm still pretty super careful with them in people who bloat or have a lot of abdominal discomfort, but if you start with a low dose and slowly escalate it, that can really ease people's transitions. That's number one. Number two, there are specific probiotic strains that decrease visceral hypersensitivity, and so intelligent use of those can make it easier for people to adapt. And number three, there is a technique that is practiced by a lot of psychologists now called gut-directed hypnotherapy. And this is incredibly effective for people whose guts are just so trigger happy when it comes to this gas production. It essentially reprograms the connection between the brain and the gut brain so that the brain no longer basically has a freak out every time there's gas production in the gut. So that can just make it easier for people who are really, really, really struggling.
Okay, that's interesting advice, and probably take that on. All right. Well, I guess we're running out of time a little bit, but I really, really appreciate you coming onto the channel and sharing your knowledge. And
it's my pleasure. Yeah, I love talking about this, and it's so cool to connect with people who are really super passionate about this, and and to just share with your audience too the science about this rather than the bro science. That bro science.
Oh yeah, exactly.
And
Exactly.
especially
And there's a lot of it out there. But in any case, we just have to keep leading by example, I think, and showing people the results that we're getting, and I think that's the best way to do it, instead of get caught up in all the noise and the confusion that surrounds it.
That's right.
Fantastic. Well, again, thank you so much for coming on the channel and sharing the information. I'm sure a lot of people will get a lot of good information and tips out of what you've just gone through. And if you're watching this and you're thinking about the ketogenic diet or a high-fat diet for IBD or for anything else, think twice, because you really have to take into account the long-term damage, as Robyn mentioned, that can occur in the body because of this kind of lifestyle, and really look into the science. And I'll link again. I said Robyn's article is linked below, so if you want to dig deeper into what she's talked about, you find all the information there. So thank you again. If there's any last words before we shut down the call.
I just want to echo what you said. You don't want to mortgage your health for that short-term gain, okay? And that's just such an important message to get through, especially in today's world where people do have short attention spans and they want it now. They want the weight loss, they want the whatever now. Okay, now hang on a minute. Just take a couple of deep breaths and think about the long-term consequences of your choices, because they can be hugely significant.
Absolutely. All right. Again, thanks a lot, and thanks everyone for watching, and we'll see you in the next video. Cheers.